So my name is Sophia. I'm an MPH leadership student. I'm currently interning with Be Well, so hence why I'm in charge of this whole thing. I chose to do a burnout panel discussion just because, one, it's a super important topic to discuss, especially with students nowadays. And two, the school doesn't have a lot of resources or activities geared towards burnout. And so I really wanted to see what you guys have in mind, like what you do personally, what you'd really want the university to provide for you, and all of that fun stuff. So yeah, everybody else wants to go ahead and introduce themselves. Lexie, do you want to start?
Yeah, that's fine. I'm Alexi Vasquez. I'm a third-year dual degree PA and PH student. So I'm in the last week of my PA degree, and then I'm finishing up my public health internship with the local nonprofit. I'm also a class officer, my PA class, and a student tutor, and members of a few local campus organizations, and have helped plan some big things like the PA versus PT fall football games is next.
Isabella?
Hi, I'm Isabella Moon, and I'm the current TCOM second-year student.
Dr. Hall, is that it?
You can just call me Jarod. I am an alumni, so I graduated from the physical therapy program at the UNT Health Science Center back in 2014. Practiced locally, and I helped manage a group of several clinics across the DFW Metroplex, and I still work as an adjunct faculty member at the UNT Health Science Center right now, teaching in their orthopedics curriculum and in business and health and exercise curriculum.
Is it Chidie? Is that how we pronounce it?
Yes, Chidie. That's right. So I'm a third-year pharmacy school student, and I'm also currently the class president of our third-year pharmacy school program. Whoops. And I'm also a tutor. I also am the king of double booking, so I understand burnout is definitely like one of those big things that I personally do go through, being someone who does way too much sometimes. But yeah, I'm happy to be here.
And then Lauren.
Yes, hello, I'm Lauren. I am a third-year pharmacy student alongside Chidie. I am the executive president for the Pharmacy Student Government Association this year, and I'm super excited to be here as well.
Great. So like I said, it's just about burnout in this panel discussion, whether you've experienced it, a friend, a parent, literally anybody in your life. I'll go through the questions. I know I sent you all the questions. They were kind of just a skeleton guide. I kind of just want it to be a very informal conversation about people's experiences, any tips, tricks you have for anybody, any questions you might have in terms of how somebody else can support you and that kind of thing. To start us off, I will explain in case any of you don't know, but burnout has 3 dimensions technically in order to classify it as burnout. So there's going to be exhaustion, which is just fatigue. You'll have depersonalization, which is typically going to be apathy towards your work, whether that is professional, school, or even like personal, like family time, relationship, that kind of stuff. And then a lack of self-efficacy. And so that is just a lack of self-confidence towards your work, or maybe just a lack of self-accomplishment as well. And so student burnout's a very, very new topic. And so typically the way we see it, we'll see it with employee burnout. And student burnout is just going to be that evolution of stress among like the student timeline. And so I really, like I said, I want to accomplish 3 things with this discussion. I want to talk to you guys about burnout. I want to come away with knowing what resources you currently have. And then third, I want to know what UNTHSC can provide for you. So if there's a resource on campus you like, but you might not be able to access it, you might not be able, it's not flushed out enough for you, I want to know what that is, or if there is just something you feel is lacking on campus that could be there to support you, especially in terms of stress and burnout, because that is difficult. And so I guess the first question I have for anybody, and free for all, take it if you want it. But how do you define and describe burnout for yourself? What does it look like when you start to see yourself kind of falling down that hill into that burnout?
I think for me, one of the first things I notice that I'm aware of is kind of that depersonalization aspect. So that can look like, maybe I start dreading opening up my laptop to look at course materials, or I start feeling that sense of dread as I'm driving to campus, or feelings like that where I can identify, oh, I'm not, even though I love being here, even though this is where I always saw myself and it's a dream and all of those things, you start losing a little bit of that excitement about your career or excitement about your courses, and it starts turning into a little bit of that dread or the monotony of like, I have to do this and not I get to do this or I want to do this.
I would
Yeah,
agree with Isabella.
Go
Oh,
ahead,
I'm sorry,
Lauren.
Lexie.
You're fine. No, go for
I
it.
definitely agree with what Isabella said, because I know for myself, when I burn out, I feel it physically. I'm like physically tired all the time. It's very hard to just like want to do things again and just find the joy in it. So I can totally understand your definition of burnout for yourself. So I agree with that.
Yeah, I was going to say something very similar. I think my definition is either mental, physical, or just emotional exhaustion, often from overextending myself. And a lot of times those are things that are fun and things I like to do, but they just become something that's no longer fun and no longer seems like a privilege, kind of like Isabella was saying, feeling like learning is no longer a privilege, more of a pass or something along those lines. That's when I noticed myself feeling burnt out.
And I was also going to add to that as well. I do agree with everything. And for me personally, I'm a morning person. I really like to wake up early and do things early. But when I start to notice myself burning out, like I wake up early and I really just don't want to get out of my bed. I just want to stay there and just go back to bed. And I'm like, yeah, that's when I start to notice that I'm personally burning out. And then also when I start to notice that when I start to notice that I'm doing the work, because normally when you like something and when you're enjoying something, you don't really notice yourself doing it. But the moment that I start to notice that I'm doing it, I'm like, whoa, this is a lot. And whoa, I'm like starting to not want to like officially like do this.
Yeah, I'm the old guy in the chat, so I guess maybe I can add a little bit more. I appreciate you guys describing your experiences with burnout, and it looks a lot like the burnout that I've had as well. And I'm old enough now to have gone through multiple periods of burnout in my life, right? Whether it was undergrad, whether it was grad school, whether it was early in my career in my first job, taking on new roles and responsibilities while trying to maintain a personal and professional life, and various other things. So I'm super impressed by you guys' ability to, number one, recognize it and self-reflect, because a lot of people don't recognize burnout in themselves until maybe it's too late. They start maybe being self-destructive a little bit towards personal relationships, being self-destructive towards themselves and things like that, and might get really deep down that rabbit hole before they recognize or are willing to ask for help. So I just wanted to applaud you guys first and foremost for being willing to have this discussion and talk openly about it. And then also maybe provide a little bit of encouragement, because I have been through multiple periods of burnout. And while you're in that period of burnout, it's much like depression, or it's much like anxiety. People don't necessarily see an end to that. They feel like, well, I'm just burnt out, right? You're in pharmacy school, or you're in med school, you're in PA school, whatever it may be. And you're like, oh my God, like if I'm burnt out in school, how am I going to make it when I get out into practice? Like this is my career for the next 40 years or whatever it may be. But having been through it multiple times, I can say that if you can stick to healthy strategies and you can keep yourself grounded, those periods do often pass, and it can be a long time before you encounter another period of burnout. So I think the recognition of the potential for transience and the potential that you will get reinvigorated through various different avenues is something that I wish that somebody would have told me earlier in my life.
Thank you. I really liked that. Chidie, you said you notice like when you can't get out of bed in the morning and it feels very, very hard to get motivated and kind of step out. I 100% agree. I used to get up at 5 a.m. every day. And then about 6 months ago, I was like, no, I'm not doing that anymore. And so now I'm sleeping until like 7, which is good in its own way. But yeah, that was when I noticed when it got really hard to kind of stick to that schedule I had. But that leads into the next question, which is what do you do to help resolve those stressors in your day-to-day routine so it doesn't just tumble and feel like a snowball? And then all of a sudden, like Jarod said, you're stuck in this burnout and it just feels never ending.
I know for myself, I have to do like activities, like whether that's like taking an hour to watch TV or taking an hour to FaceTime a friend or something, just taking those time periods for myself. And actually, which is actually really crazy, is I actually feeling burnout right now, just being a P3 student and being the spring semester. And I actually had a talk with one of my mentors today that kind of motivated me to be like, okay, I can do this again. So I feel like talking to somebody that you trust can help build back your spirits and kind of remotivate you to kind of finish it out and finish strong.
And sometimes this can be very hard to do, but just turning off your school brain. I know like we're all in professional programs, so that's not always like the easiest thing to do. But I've noticed that whenever I am definitely experiencing burnout, I just have to say, okay, Chidie, you need to like do something that makes you happy. Don't think about school for X number of like hours and just do something that makes you happy. For me, I love to do art. So I do try to sprinkle in art here and there, or just something that I can throw my emotions into and I guess release the stress that is burnout. And I feel like for me, that's just my outlet of getting my burnout out.
I think kind of for me, the past situations where I've dealt with burnout, I've found that a lot of it has to do with compassion fatigue. I mean, that's something that a lot of people who are in health professions struggle with, where you're always taking care of other people. It can be hard to take care of yourself or to identify like, hey, there are always going to be more people out there for me to help. And it puts pressure on you to just keep trying to take on more and more and more. And you start spreading yourself thin, and then you lose that like reserve of energy and you start burning out, and it feels like you're against an impossible to accomplish goal of fixing the entire world. So, kind of like Miss Lauren was talking about, is talking to somebody who has that like some outside perspective on it and can help you recenter yourself, or maybe reading a book, or even just, taking time. Like I talk to my therapist a lot about compassion fatigue and burnout in school, from experiencing it myself, and realizing like, hey, you can't do everything, you can't solve every problem, and sometimes you have to figure out which things in your life are okay for you to let go of for a little while, to give yourself the space and the time you need to build that energy reserve back up so that you can keep doing your job and kind of give yourself that time to de-stress.
I think Isabella like really had a lot of insight there with what she laid out in healthcare professions, which we all are a part of. Compassion fatigue it's a big deal. It's a big thing that continually comes up. It comes up in the literature. It comes up in discussions. It comes up at conferences. And one of the hardest self-realizations that you can have is that you can't help other people when you're not in a good place yourself. So recognizing there's a really delicate and difficult balance to draw between recognizing self-care and understanding, still being empathetic with people, still having care for them. If you're not taking care of yourself, if you're not setting some boundaries for yourself, and that's going to look different for every person. I appreciate this as a panel discussion with a lot of different people's inputs, because oftentimes just the canned answers, hey, do this, X, Y, and Z, follow this program, and then you'll be good and great. That doesn't work for everybody. Chidie mentioned art for him. Maybe it's engaging in family time for other people. Maybe it's exercise for other people. Maybe it's whatever it may be, right? Having things that you recognize recharge your batteries, and for fear of getting too much into professor brain. I know all of you guys have probably heard the concept of homeostasis, but I don't know how much you've heard of the concept of allostasis. So maybe like a show of hands, if anybody in the screen, there's a concept of allostasis, or what's called allostatic load. And if you think of the perfect homeostatic environment as maybe a circle with a dot in the middle, and when the cell is in perfect homeostasis, the dot is right in the dead center. And as you add allostatic load or allostasis to a system, you push that dot further and further and further towards the edge. And the more that a person is taking on, the closer they get to the edge of pushing out of their zone of homeostasis, and allostatic load becomes too much for them, and it causes flare-ups of burnout, anxiety, depression, sleep issues, so on and so forth, right? Anything that you can think of. And so recognizing what are the things in my life that can mitigate allostatic load, and recognizing what are modifiable and non-modifiable variables and risk factors. And a lot of people stress a lot about non-modifiable things and don't focus on modifiable things in their life that maybe they could address. So that empowers you to focus on the things that you can have an impact on, and it really disempowers people to focus on things that they can't necessarily impact. So understanding that concept is really valuable for yourself. It's really valuable for patients, and it was something that when I learned more about that concept and understood it and how it relates to my personal life, made a big difference in my ability to set boundaries for myself.
Yeah, I like what you guys are saying about priorities and setting boundaries. And I think even one thing for me that was a modifiable factor is just allowing myself to rely on the people that are around me. So whether it's family or friends or significant others, letting them do things for me that took things off of my plate so that I could feel some sort of rest in that. So I think that's one very practical thing to do in addition to what you guys mentioned.
Yeah, I have heard of allostatic load. I took a nutrition class when I was an undergrad. So as soon as you said that, I was like, okay, I know where he's going. But I like that you all mention support networks and who you can rely on. It can be really difficult, especially coming out of the pandemic when we were also isolated and everything's virtual, still virtual in some cases. But I guess it's really scary sometimes to go and ask for help and kind of be vulnerable with it, because when you're burnt out or when you're dealing with any mental health issues, it does require you to be vulnerable at moments and asking for help. And so I guess the next question would be, how do you find those people? And two, how do you ask for help? What gets you to that point where you go, okay, I need somebody to, even if it's just listening to me rant for 30 seconds about this class, I just need somebody here and like hearing what I'm saying. So how have you guys managed to do that? How have you figured and learned how to do that?
I think the people that are already around you in your life and see who you currently have and who's in your support network and who can possibly assist you in things that you may need, but just being honest and vulnerable, saying that you need those things, or I need this time, or I just can't do the dishes today. Can you please do it for me so that I can like take a little break or whatever it is? And then if feeling like you don't have people within that network to do those things for you, just look around at your classmates, because you guys are all probably feeling very similarly, and find ways to support each other that can take loads off of each other. Like if you guys all get together and make a meal together, and then you meal prep for the week or whatever with your roommates or your classmates, people that are in that season of life with you, that could also mutually benefit.
So you said something, that you have to go and find those people. But it's not like you also said like it's kind of a give and take. Like you also have to kind of be able to open up and be like, what can I do for you? Like, how can I help you? And that can be especially challenging. I was watching, I can't remember what I was watching the other day, but it said kind of that same thing where it was like you can't always be the taker. Like sometimes you have to sit there and you have to give and you have to be empathetic, and that can be extremely difficult, especially when you do have compassion fatigue. And so, like Jarod said, setting boundaries, even if it's with yourself, with your friends, with your classmates, whoever, how do y'all set those boundaries? I guess those emotional boundaries, especially during times of burnout or when you feel yourself getting overly stressed. How do you learn how to manage those boundaries so that you're not kind of overextending yourself?
So I can kind of talk about that a little bit with I lived with my parents like in their house until starting school, like graduate school. And so they were always used to being in constant communication with me and just, talking and catching up about our week and stuff like that. And in graduate school, I just don't have the time to do that. Especially when you start facing things like burnout. So when you hit that point, for me, it's just about good communication with them. Like if my mom calls me and it's a day where I'm feeling like I don't have a lot of time, sometimes I just have to tell her, I care about you. I want to hear what you have to say, but I don't have that time right now to give you. If you want to hear about my day, I can talk to you about some things that are going on so you kind of have some insight into my life and we can kind of connect that way. But to be honest, I'm already processing so much that I don't think I can talk to you about how work is going for you or stuff like that. And that can be a hard thing to tell somebody you care about. But saying that and telling them like, I want to honor and respect your time, and I want to honor and respect the feelings I have for you, where I care for you. I don't want a conversation with you to be taxing to me or feel like, maybe something I'm dreading or it's taking me down. And I think you'll find that like a lot of the people who care about you, when you tell them that or you tell them you're struggling like that, they're very respectful and receptive to that. At least, the people I've opened to up like that have been. So it kind of takes a little bit of a leap of faith and kind of some upfront communication. But
I feel like for me personally, setting boundaries is still somewhere, or it's a place where I'm still struggling. I'm the listener, so whenever someone does have like something happening, I will, and this is where again I know I'm taking on a little too much, but I will be that person to say, hey, okay, I'm here to listen, and I still am very, very bad at setting those boundaries to say, hey, I'm currently not in a good headspace at the moment, and I still take on everyone's like, not pain, that's the wrong word I'm looking for, but everyone else's problems, that I take that on to myself. And I know that's something I'm still trying to work on. I've gotten ever so slightly better at it. Especially like around finals time, where I know that I'm like at peak stress mode. The moment that finals are over, I drive back home and I tell everyone, hey, this is going to be where I take a week to myself and just do me. And so that's how I'm slowly getting better at it. But again, it's still something that I'm struggling with and I do need to work on. I just don't know exactly how exactly I should go about that.
so
I think, sorry.
I was just gonna hop on and say real quick too. One of the Speaking of like campus resources and reaching out to people, I did reach out to the care team within the last semester, and the director gave me this book called Trauma Stewardship, and it talks a lot about like when you basically are listening to people and taking on their trauma, even if it's minor, like day-to-day trauma, and how to process that and have space for yourself while also taking on things like stressors from other people. So I used to struggle with that a lot, and I still kind of do because I'm still learning, but that was a really great resource the campus provided. Sorry, Miss Lauren.
Oh, you're fine. And I just go back to what Chidie was saying. Boundaries are super hard to set, especially if you're not used to it. But I also found it easy for myself to set like small boundaries. Cause I know like for us, like we're super involved. So what I usually do myself is after any organization stuff. Like that's my time to focus on school and maybe relax a little bit. So if you start small and then eventually like build up on that, I think that will help with kind of setting discipline for yourself and being very open and having that easy conversation when it comes to telling people those boundaries. I think just starting small will kind of help.
I'm kind of in the same boat as Chidie. I don't like disappointing people. And so it can get a little scary when you have to set those boundaries, especially because I think people often misinterpret boundaries as something that the other person has to do for you, rather than it's actually something you have to set within yourself, which can be sometimes a lot more challenging because you're putting that pressure and that responsibility on yourself. But what was that book again, Isabella, that you said before I forget?
Yeah, it's called Trauma Stewardship.
Yeah, the care team, there is an online portal as well. If any of you ever need that too, it's called Life SSP or LifeWorks. And so that is an online therapy session that you can also do, and it's free for all students. And so if any of you need that, but we're heading towards the direction of this next question, which was what strategies do you use to recover or even prevent burnout? So when you do start to see yourself kind of falling into that fatigue, what do you do, not necessarily to snap yourself out of it, but kind of give yourself a little bit of extra self-care in that area?
One of the things that I do is I always take time for therapy. So kind of like we were talking about that SSP program. I've used that in the past, but our student insurance, which is through United Healthcare, also has a portal where you can get like telehealth and telemedicine visits. And they also have like mental health visits on there. So if you do have the student insurance, you can make repeat visits with social workers and therapists and stuff like that. So usually if I know I'm going through kind of one of those periods where maybe it's hard to get out of bed, or I'm driving to campus and I'm starting to feel like maybe, you know, I'm not excited to get there, I try and make more sessions so that I can kind of have more time to talk through and process that. But because our schedules are really busy, I have to try and find time in my schedule for those extra sessions. So really trying to identify what things can I let go of in the next week to give myself more space and time. That's kind of one of the strategies that I use.
I don't want to sound overly cliche, but you know, in these cases, I've found, and I believe there's quite a lot of research and evidence to support that working on the front end to prepare yourself to be more resilient to burnout is one of the most effective strategies, because if you really consider what burnout is, more often than not, it's likely a symptom. It's more likely a manifestation of other things, right? So if you're burning out, it very likely is a manifestation of other stressors in your life. It's maybe a manifestation of other unhealthy strategies, whether it's lack of sleep or anxiety and things like that, that you often deal with in very rigorous, you know, school programs like you're in now, and very rigorous jobs like you may go into. And if you really dig into a lot of health related problems that we're going to help treat in the future, many of those are manifestations of a complex multi-system dysregulation, you know, that may occur, whether it's metabolic, endocrine, immune, so on and so forth. So the strategies a lot of times that you can take are actively engaging. And again, when you're setting these boundaries for yourself, you're actively engaging in strategies that you know are going to make you a more resilient or healthy person in the long term. And for a personal example, for me, I'm a person that's very, very sleep sensitive. And consistently, if I find myself getting less than about 6 hours of sleep per night, I have flare-ups of chronic pain, and I have various other like stress-induced, really unhealthy eating habits that manifest and things like that. and that's really common for a lot of people. And I'm a bit of a sleep research nerd myself, and you consistently see manifestations of a lot of multi-system problems for people who are chronically underslept. And I would say most of you guys are probably chronically underslept, dealing with the things that you're dealing with. And guess what? A lot of the patients that we'll work with in the future, they're chronically underslept too. So one of the things, a boundary I had to set was, well, if it's after 8:30 p.m., I'm not messing around on my phone. I've put blue light filters on my phone to try to maximize my circadian rhythm and my sleep-wake cycle. I've recognized that I'm an early morning person, like Chidie mentioned, and that even if I stay up till 1 o'clock in the morning, I'm probably still going to wake up between 5 and 6 a.m. And what have I done there? I've set myself up for 4 to 5 hours of sleep if I was perfectly asleep that entire time. So I had to set the boundary on myself that I'm not allowed to, I can't let myself stay up really late consistently. And there's a little voice inside you that says, but I need to cram, I need to study, I need to do these things, I need to get that information in, I have to get through one more page. But the silver lining is all of the research says that you actually retain less if you don't have that sleep, the sufficient amount of sleep, and people actually consistently perform worse on school exams and that sort of thing when they're chronically underslept. And we could go down a lot of different rabbit holes, but I just wanted to focus on sleep myself because I think that's the most personalized to me. But you might find those things to be different for yourself.
Yeah, and to your point, I think setting boundaries requires insight to recognize the things that we are limited in doing, our own personal limitations, that we can't go without sleep for X amount of hours and still operate at a normal level. And so recognizing our human limitations and embracing that and things that we currently do that are healthy and unhealthy, and being willing to confront those things.
Yeah, if you guys will let me just drone on for just a couple more seconds. This is a discussion that I have with patients a lot. I happen to focus in working with people with chronic pain. That's my subspecialty of rehab physical therapy, and that allostatic loading model that we talked about a little while ago. There's a really nice analogy that one of my mentors taught me. And it's essentially, if you imagine a cup, every person, we're each a cup. Some cups are a little bit bigger, some cups are a little bit smaller. And what that really symbolizes is that every time you engage in activity, you do work, you do stress, you interact with school, you interact with people, you do taxing things, you do physical activity. Well, that pours a little bit of water into your cup. And at a certain point, everyone's cup overflows. And when you overflow, that's when you get to burnout. That's when you get to a flare-up of back pain. That's when you get to a panic attack or anxiety or whatever it may be for that individual person's manifestation. Well, there's two ways to try to mitigate that. One way is to find ways to put less stuff into your cup, and that's setting boundaries. That's recognizing modifiable and non-modifiable factors. And then the other way is to get a bigger cup. That can hold a little bit more, and that can be achieved through a lot of different ways. Whether it's you get a bigger cup through spending a lot of focused time with family and friends, and there's a social aspect to that. Maybe it's church, and there's a spiritual aspect to that. Maybe it's physical with an exercise and just general physical capacity and metabolic load standpoint of, you've reduced stress and inflammation on your body, so on and so forth, right? You guys can imagine the different domains of health, and there might be a way to help get a little bit bigger in all of those domains. And that's a conversation, like I said, I have almost on a daily basis with people, and we start working on what can we do to affect both what goes into the cup, but also how much your cup can hold. And hopefully that's a helpful analogy. I know it's always been helpful for me to visualize.
Yeah, that one. And then there's the chart one where it's like stress and then activities or stress activities. And it's like you need a certain amount of stress to get to the activity, and you kind of plateau and you're cruising, and then too much stress and it drops off and you don't want to do anything. And so that's one way I visualize like my burnout is kind of what Jarod was saying, and then just also that stress meter. And so oftentimes when I'm bored or irritated with an assignment, I'm like, am I bored, or is it too much? Is it too hard? Like what's stopping me? And I kind of do the same with burnout and the activities that I do, especially if it's something that I used to love and I was so excited to wake up and get to do it. And then I'm like, am I bored, or is it getting too hard? Like what's the issue? And so I really like that. I'm going to keep that metaphor in my back pocket, Jarod. Thank you. But I guess also you're talking about like undersleeping, like chronic undersleep. Do you see the same thing with like oversleeping? Because I know burnout, kind of like the foundation of it, matches depression and those presenting symptoms. And so you see oftentimes with people who are struggling with depression, they'll oversleep or they'll undersleep. And so I'm wondering if you do see that kind of, or anybody, if you ever, like if you're oversleeping, do you see that affects your burnout or your anxiety or anything like that more?
Yeah, I can't say that I personally experienced that, but when you really dig into the sleep research, you see negative health outcomes with less than 7 hours and more than 9 hours tend to go together. So if people are sleeping more than 9 hours, oftentimes, and that's an arbitrary cutoff, but if people are sleeping a lot, it's probably a symptom of something else going on in their life. And that might be something that you recognize within yourself, like, wow, I slept for 10 hours and I'm still so tired. What's going on here? Maybe I need to recognize that that's kind of the sign and dig into it a little bit further.
Yeah, sleeping's hard. No matter if you're doing it more or too less. I know like I have friends who are chronic insomniacs, and so they wake up and they're just kind of dredging the day just because you don't have the energy, and then if you oversleep, it's kind of the same thing. And so with burnout, I often see that lack of motivation too, and that often like stems into your I guess into your day to day and like your routine, and like you were saying, like it just gets too much. And so what do y'all do to kind of placate that? I guess like I know we've talked about it and you said like you kind of hold firm to those boundaries, but do you add something new to it? Do you take an extra step in your self-care, or do you just kind of firmly be like, no, like this is my routine and I'm going to do it no matter how tired I am, how stressed I am?
Can you repeat the question one more time?
Yes. So when you feel yourself start to get stressed out and I guess overwhelmed with everything, do you tend to kind of more firmly stick yourself in your routine and say like, no, I'm not changing anything. This works for me. I'm going to do it. Or do you find that you have to add like an extra self-care step? Like you have to do something more to kind of care for yourself that day or that week?
I think it's a little bit mix of both. For myself, I just try to stick to what I set for myself, but also try to like, if it's a really bad day, I'm just like, okay, I'm just gonna do a face mask or something. Like I'm just gonna take that time for myself. So it really depends on the burnout I'm experiencing that given time period. I feel like every burnout period is different. I know for myself, it's very different depending on what season it is. Finals might be one type of burnout. Right now might be just a burnout because I just don't want to go to school anymore type of thing. It just depends. But I think just staying firm to the boundaries, and sometimes you might have to add to it too, just to kind of continue to kind of just, I don't want to say protect yourself, but just kind of just continue to kind of just set that for yourself and keep consistent. I feel like consistency is key, especially when you're trying to take care of yourself.
So are there any resources that you use that you wish you saw was more accessible, whether that is in your personal life or if that is at school, like on campus? Because I know we've talked a lot about like mental health resources, but a lot of times there's like a lack of, I guess, like activities, and like Jarod was saying, like those preventative measures. And so what do you really need? Like right now in this moment, what would you need to kind of help protect you against future burnout and those symptoms associated with it?
I think one aspect is catching it before it gets to the point where I'm starting to have like the physical symptoms, like, you know, not being able to wake up and stuff like that. And having check-ins, like my classmates and I check in on each other and just do like almost like a wellness check, but more of like hey, how has this month been for you? How has this block been? And then also I have like a faculty mentor. So having that component where they can check in and say, you know, you don't have to worry about like, it's not a professor. It's not somebody who's gonna like be wielding anything over you. It's just somebody to say, hey, I care about you. I want to see how you're doing. Let's talk about it, because then I'll find myself being like, oh, you know, I guess I am feeling a little burnt out, or, you know, I'm not sure how to handle this situation. And they might be like I've had one of my mentors say to me before, hey, maybe you're doing too much for that org right now and you need to, you know, reprioritize things. And it's kind of humbling to have somebody be like, hey, check yourself, but it's also like, it's good. So that's one of the things that I've found, but it's also sometimes hard to find a mentor or find one who like understands your perspective, because for some people, maybe it's been too long since they've been in school or they don't have a similar background to you. So I kind of wish that there was because I know there is a mentorship program on campus. I just wish that were more publicized.
Again, I can only speak for myself. Sophia, you talked about maybe during periods of you feeling burnout, or we'll call them a crisis period or whatever it may be, what are things that you can add or that maybe wouldn't be part of your normal routine that would help you? For myself, it's more about subtracting than it is about adding. I think there are things that I would add might be, you know, a bit of meditation, and that can be guided or that can be self-directed. There's some great apps like Calm and Headspace, and you know, but there's also some great just free videos on YouTube and that sort of stuff to get grounded. But oftentimes for me, it's subtracting. It's removing social media or things like that. I'm an avid reader, and it's switching from reading educational material to reading material that's maybe a little bit more fiction based and engaging my mind in a different way. Because I've historically been somebody that if I wasn't overachieving, I felt like I was failing. And after listening to you guys for the last 42 minutes, I kind of get the feeling you guys are really similar. Listening to your resumes and hearing all the things that you're involved in, I bet you guys suffer from a little bit of imposter syndrome oftentimes, where even though you're super achievers, you feel like you're not achieving enough. I can kind of get that vibe. So for me, sometimes it's less, you know, and the idea that I can get away, I can turn off some of that stuff. It's okay to not be hyper achieving every waking minute of every day, and just engage in a little bit of fiction, or just remove social media and you know, the keeping up with I know that doctor does this, you know, he's got all this stuff online and they fix everybody and they cure everybody. And I watch those videos and I see these hyper achievers and I compare, right? And in comparison is the thief of joy. So you start doing all of that type of thing. And I might be getting a little bit off topic here, down a rabbit hole, but that's something that I've recognized in myself that can make me feel burnout, is trying to hyperachieve and catch up to maybe an unrealistic expectation and that sort of stuff. So I try to go the other direction and actually focus on subtraction rather than addition.
One of the other things one of my mentors told me recently was like, your value as a human being isn't based in your productivity. And that just blew my mind. I was just like, oh, yeah, I mean, that makes sense, but it's crazy because I think we're in such a productivity driven field, and it attracts a lot of people who kind of tend to think like that, and realizing like, oh yeah, there is more to me than just my productivity and my output. And you know, maybe reading a fiction book and I have other interests and I like doing art and, you know, stuff like that. It brings that back that joy. So.
Yeah, burnout often does feel like almost a rite of passage, especially in our community. And so, yeah, it can be tough when you do feel like you have to not only compete with everybody else in the world, but also with yourself and think like, you know, last week I was, you know, up for 12 hours studying and this week I can only manage 8. And so it gets really, I know it gets really difficult. But if we can finish early, but if there's anything else that anybody really wanted to mention about burnout, feel free to. All right. Well, I really do appreciate this conversation. Like I said, burnout, I know it's not only important to me, it's important to all of you. Obviously, you would not be here if it was not. But I really enjoyed listening to y'all stories and your advice, what you had to say. And like Isabella said, having a mentor is really important. And studies do show that if you have, whether it's peer mentorship, faculty, or even just somebody in the community to have to kind of fall back on for that support, especially if they're in your field, that actually reduces our stress a lot. And a mentorship program is actually something I have been kind of vibing with and trying to figure out how we can do that a little bit, I guess, more reliably at UNTHSC, because I know each one of us needs it. But yeah, I'll let y'all go. I really appreciate your time and your words. It's been a lot of fun talking with all of y'all.
Thanks,
It
guys.
was nice meeting you guys all.
Thanks, Sophia.
Thank you.
Good luck to everyone.
Yes, thank you.
Thank you so much.
Thank you.